So, good news and bad news, folks. The good news is that after 4 years of clinical trials showing that it is safe, it is causing minimal, if any, side effects, a brand new COVID vaccine is available to the public. The FDA has approved it. Again, 4 years of clinical trials showing no issues that are of any concern. So the Novavax vaccine is officially coming to an inoculation center near you. Now, here's the bad news. You can't get it. The reason for that is because the FDA, under the direction of Health and Human Services, which is under the direction of Robert F. Kennedy Jr., has decided that they are going to restrict who actually gets to take this vaccine. 4 years of clinical trials, full FDA approval with no red flags, no black box warnings, no nothing. But Health and Human Services says, you know what? Let's just make it to where not everybody is allowed to get it. You're not allowed to take this new Novavax vaccine unless you can prove you have at least one underlying condition, medical condition diagnosed that shows that you are at high risk of complications from COVID-19. Now, as many of us saw during the height of the pandemic, if you have lungs, you're at high risk. Many of us likely know somebody, I know several of them, by the way, no underlying medical conditions, no diagnosed problems, no lung conditions throughout their entire lives, yet they became severely ill. I had a family member who ended up on a ventilator. We basically were going to go up and say our goodbyes because we thought it got to that point, but she did eventually overcome it. But she had no underlying medical conditions. And she wasn't over the age of 65. But according to Robert F. Kennedy Jr.'s Health and Human Services, nope, that kind of person is not allowed to get this FDA-approved vaccine that went through 4 years of clinical trials and didn't show any problems. If you are a caregiver for elderly people or people with compromised immune systems or, risk factors for COVID, you can't get the vaccine because you don't personally have an underlying condition that could make it bad for you to get COVID. Again, if you have lungs, COVID can be devastating. We are only now just scratching the surface of what was called long COVID and the scarring and problems that it causes in otherwise healthy people to their lungs and breathing, folks. But this is what happens when you put a science skeptic in charge of our nation's health. A fully functioning, totally normal vaccine that he's like, nah, you know what? Let's just say these people can't get it. Who the fuck does that benefit? Why even have an FDA at this point at all? Why even have prescription drugs? Why even have vaccines, right? If you're going to restrict who is allowed to even have these things, then nothing matters anymore. Science doesn't matter. Medicine doesn't matter. And this is why you have to put intelligent people in positions of power instead of dipshits like this. Because this is the level of stupidity we're dealing with. Now, I will be clear. I don't know, because it is not mentioned, if this directly came from Robert F. Kennedy Jr. or if it's just the department's new policies. But as the guy who runs the department, he is where the buck stops. So his department is doing this. And if he doesn't want them to do this, then he needs to come out and say, oh, hell no. Anybody who wants the vaccine, they can go get it. It's approved. Why not? But no. This is what we get. This is what we get when we put science deniers in charge of science. The most ass-backwards policies that we couldn't have dreamt of in our wildest dreams. Thanks for watching, everybody. And if you're not already, please subscribe to the channel. We got fresh content every day for you. And If you want to follow us across social media, make sure you check out all of the social links that we have posted in the description of this video.